Welcome to part 2 of Approach to Patient with Rheumatological Disease lecture. Answer the following questions about the nature of the joint disease: articular or non-articular, acute or chronic, inflammatory or non-inflammatory, pattern of joint involvement, extra-articular features, articular or non-articular. Articular pain is localized to a specific joint. Both passive and active range of motion, ROM, are restricted in all planes. Non-articular pain originates from periarticular structures, tendon or bursa. Only active ROM is restricted in the plane of involved structure. NB, diffuse non-articular conditions occurring in generalized hypermobility and fibromyalgia, diffuse aches and pain. 2. Acute or chronic. 6 weeks is the duration needed to determine if the cause of arthritis is acute or chronic. Acute arthritis will be less than 6 weeks, as in septic gout or reactive arthritis. Chronic arthritis will be more than 6 weeks, as in osteoarthritis or rheumatoid arthritis. We start the history by 3. Inflammatory or non-inflammatory. Inflammatory disorders identified by local cardinal signs of inflammation, erythema, warmth, pain, swelling and loss of function. Prolonged morning stiffness greater than 1 hour. Systemic symptoms: fatigue, fever, weight loss. Elevated ESR and CRP. This table shows how to distinguish between inflammatory and non-inflammatory arthritis as regard local symptoms, morning stiffness, systemic symptoms, synovial fluid analysis, other lab findings, and lastly radiographic. 4. Pattern of joint involvement. We make analysis of joint involvement as regard number, sequel and distribution. As regard number of joint involved, monoarthritis, only one joint involved, as occurring in traumatic, septic and gout. Oligoarthritis, from 2 to 4 joints involved, as in SPA. Polyarthritis, more than 4 joints involved, as in RA and SLE. Sequence of involvement is how the joint involved progress. We have 3 courses of disease progression: migratory, as in acute rheumatic fever, intermittent, as in gout, and additive course, as in RA. All will be discussed in face-to-face session. Distribution of joints involved: symmetrical or asymmetrical, axial or peripheral, large or small joints. All extra-articular symptoms will be discussed in face-to-face and clinical session.